So since it's now well into fall and it's officially laser season here at Belle Visage, I wanted to kind of help you understand a little bit about the different ways laser works. Lasers come in all kinds of different wavelengths, and we're not going to go into that during this video, but if you think about lasers being classified as non-ablative or ablative, and what that means is think about the layers of your skin, and if you're doing non-ablative, we're not ablating, or we're not taking away any of the surface layer of the skin, but generally we're either applying heat to the surface to go down into the skin and cause that elastin to wake up and bring collagen, or we're drilling, putting little fractionated holes down through the skin to induce a wound, much like we do with microneedling. This is like an optical needling or a laser needling. When you're doing non-ablative, that means you're not taking any layers off the top, but you're still applying injury to the area to bring collagen and elastin. So non-ablative has the least amount of downtime, 3 days maybe. The most common things are feeling a little rough, like sandpapery on the skin, a little bit of redness that can persist for a week or so, but generally most people do this and can go back to work, and it's not really anything that looks like more than a mild sunburn for most people. So non-ablative is great. You can really technically do non-ablative any time in the year as long as you're wearing sunscreen. The second category is ablative. This is much more aggressive. This is kind of the gold standard category for anti-aging and retexturizing the skin. But ablative, just think about the layers of the skin again, but when we're doing an ablative process, we're actually burning away or taking away some of the top layers of the skin and leaving the baby skin underneath. So depending on how many layers we take is how aggressive the treatment is. You can also add the coring or the laser drilling for fractionation on top of that. So not only do you get layers taken away, but then you drill down so you can get an even deeper, more aggressive type of a treatment. This is kind of, the more aggressive we go, is more healing time. So the nice thing about that is you don't have to do those kind of treatments all the time. Some people do it once a year. Some people do it once every 3 to 5 years. There is about 7 to 10 days of swelling. You can have some kind of oozing skin or crusting skin. You probably don't want to go out during those days. Some people swell more than others. Some people are more red than others. Some people are more drippy than others, but we treat it much like a burn and use like 𝗏 or something to keep the skin moisturized during that time. For most ablative procedures, you can have up to 3 to 4 weeks of persistent dryness and a little bit of redness in areas that we were a little bit more aggressive. And that's just that baby skin under there that's just kind of thickening up as it's healing. Most people are putting products back on their face and makeup by day 7 to 10. If you're having a lot of texture, the skin looks like orange peel, you're looking like a lot of deep wrinkles over the lip, a lot of deep crow's feet, the glabellar lines, we can do spot treatments in that area and do an overall treatment to your face, but go back and go extra in those areas so we can really customize it to the patient. It is more aggressive. You do have to have more downtime, but the skin result is fantastic. I hope that helps you understand the difference between non-ablative and ablative, and know that ablative is still the gold standard in aesthetics for anti-aging and retexturizing. So hope it doesn't sound so scary. It's not that bad. Most people would do it again. It does require some numbing time. We take care of that, and we get you all your post-care products too. So look into some ablative laser if you're having some issues.